This overweight patient is undergoing bariatric surgery. It's more commonly known as a gastric band operation and involves fitting an adjustable band around the top of their stomach. This band creates a pouch at the top of their stomach, about the size of a golf ball, and so drastically limits the amount of food that the person can eat. As with all major surgery, its success isn't guaranteed, and it carries the usual risks of infection and complications. The patient will need to stay in hospital overnight and will normally experience post-operative pain. Only certain overweight people can have the procedure on the NHS. Others will have to be treated privately, which can be expensive. So gastric band surgery is certainly not something to be entered into lightly. There is, however, an alternative, one that doesn't involve surgery and has a similar success rate, and it's only a fraction of the cost of the operation. The gastric mind band. Conceived and developed by Martin and Marion at the Elite Clinic in Spain. The gastric mind band procedure, which they developed, has not gone unnoticed by the world's media and has been featured in many national newspapers, including The Times, The Daily Telegraph, The Daily Mail, and The Daily Express. It's also been featured by numerous magazines, including Vogue, Easy Living, Hello, Marie Claire, and Good Housekeeping, to name just a few. Martin and Marion are professional hypnotherapists. They founded the Elite Clinic near Marbella on Spain's Costa del Sol in 2003. The reputation of the clinic quickly spread, attracting many clients, including a number of celebrities from across Europe. The clinic offers treatment for major addictions, depression, fears, phobias, and panic attacks. But it was a chance remark by a client that was to dramatically change Martin and Marion's lives, and those of hundreds of other people too. That one remark set the ball rolling on the development of a treatment which has now become a worldwide phenomenon in the field of weight loss, and has now been featured on television on both sides of the Atlantic.
It's the question that everybody asks. It came from a past client who'd been in to see us to stop smoking, and the treatment had been very successful, but she'd carried on putting on weight ever since. And so she asked me if we could hypnotise her to make her think she'd had a gastric band done, just the same as we'd hypnotise her to stop her smoking. I thought it was quite funny, and Marion and I we spoke about it that evening, and Marion came up with the idea and said, well, why not? Why don't we develop a therapy? And that was the start of 2 years of hard work, lots of research, lots of development, trying it out on many, many different people. And the result, of course, has been the development of gastric mind band therapy.
That was the light bulb moment that started 2 years of research and trials, which resulted in the gastric mind band procedure as it is today, a real alternative to invasive surgery.
As I was getting ready for retirement, I knew that mobility was an issue and I had to do something. And I did even consider looking at the actual surgery. And then I happened to see an article in the newspaper about a reporter who'd had the gastric mind band treatment, and that seemed to me to be a very good alternative. I wasn't keen on the idea of choosing surgery if it wasn't absolutely medically necessary, and so this seemed, the perfect answer to try.
During the development of the procedure, Martin and Marion realised that although it's very powerful, hypnosis alone was not enough to help clients to lose weight permanently. So, the couple combined cognitive behaviour therapy and neurolinguistic programming with hypnotherapy to produce something that is unique to them, the gastric mind band therapy. The procedure has now attracted the interest of the medical profession and other therapists from around the world and is now trademarked in both Europe and the USA. Since its launch, Martin and Marion have become specialists in the treatment of obesity, having now spent thousands of hours in one-to-one sessions with many different clients, all of them desperate to lose weight, each one with their own food-related issues.
In addition to the therapies that we use, we developed our own unique approach, which we call pause button therapy. And that really does make us stand apart from everybody else in the marketplace.
The clinic is packed with a range of advanced medical testing equipment. For example, the very latest core MetaCheck equipment developed in the USA, which can measure a patient's exact metabolic rate. The clinic also uses a Tanita system to provide details of a patient's body composition and visceral fat levels.
We've invested a lot of money, a lot of time in getting the whole process of the gastric mind band therapy just exactly to the level we wanted it to be. We have, since we launched, seen many other people come into the marketplace, some professional, some maybe not so, but our attention to detail is what's always kept us above the marketplace.
Another reason that the gastric mind band is so highly regarded is the patient aftercare that is provided. Before they leave the clinic, each patient is given a unique set of tools to help them during the all-important first few weeks. These include a detailed manual and a set of 6 audio CDs covering every aspect of their treatment. The success and growth of the gastric mind band procedure has been amazing. Last year, the book Sheeran's Solution, The Gastric Mind Band, which accompanies the procedure, was published and serialised in the Daily Mail. The story was then featured on ABC Television News and Good Morning America, and Martin and Marion have now licensed a small number of qualified therapists to provide the procedure in the USA.
That's you there, believe it or
Yes,
not. I mean, you wouldn't
is.
think that's the same lady when you look at you now. That is amazing.
The last week in July last year.
And look at you there. How much have you lost all in all?
7 stone.
7 stone.
Yes, yes.
Absolutely.
But the thought of electing for surgery when it isn't medically necessary,
I'm with you.
I wasn't comfortable with that at all.
I understand.
And then by chance I saw an article about somebody who'd had gastric mind band.
Gastric mind band, I love it.
Yeah, yeah. So I just Googled gastric mind band and found contact with a clinic that does that, and it happened to be in Spain.
What's interesting is that a lot of people would say it's not guaranteed to work in the future, but actually losing the 7 stones is such a good incentive.
Yes.
And a positive affirmation that it can be done, it probably will stay off.
It has changed my way of thinking about food and weight loss, and I haven't looked back since.
This really has changed my life, and it's been so easy to lose the weight. It's just been falling off week by week. I reached my goal weight several months ago now, and it's been so easy to carry on with it. I'm so glad I did it.